response system. That's the topic for today's training. We'll provide a quick overview of the Rhode Island homeless response system, its component parts. We're going to spend some time talking about the Rhode Island continuum of care, the different components of programs and system supports that provide operational guidance and the kind of infrastructure or the scaffolding for how all the homeless assistance projects coordinate and work together. We're going to spend a bit of time talking about the HUD homeless definition. It's sort of counterintuitive, at least I think it is. The homeless definition would seem to the average person to be very clear and simply just someone who doesn't have a home and is either outside or experiencing a housing crisis. But there are very specific definitional elements, and this is important for when your project has to document who you're serving, and it's a condition of eligibility that they meet certain homeless criteria. That could actually be a whole 90-minute training in and of itself. So we're going to talk at a pretty high level just about the homeless definition and how it might impact different projects that you operate. Then we're going to go in and define the different homeless program and project types that are part of the continuum. Each of them serves a particular function and serves different populations and has different objectives or different results at the end. And all working in concert create the whole homeless system. There's two federal funding sources that support the homelessness system, programming in the homeless system. And so we'll spend some time talking about those. ESG, which is an acronym, it stands for Emergency Solutions Grant. That's a formula grant, so funding that comes directly into Rhode Island and supports different activities within the homeless system. And then there's another federal funding source, the C of C, or Continuum of Care program. And that's a competitive application. So it's not a formula grant. You actually have to apply. And the resources are then awarded to local communities and the projects that comprise their continuum based on that competitive score, that competitive application. We'll talk about system performance and what is at least identified at a federal level for expectations around an impactful or sort of a high-performing system and how individual projects where you might be engaged can contribute to those objectives. And then we'll finish today with an overview of some of the resources that you can follow up at on your own that describe some of the information that we're talking about today. So that's a lot about Liz and myself and Housing Innovations and the agenda. We now want an opportunity for you to weigh in. And so we're particularly interested in what kinds of programs you all operate. And I'm not sure, I think our friends at Rhode Island Housing have to initiate the poll. But the question is, I'm a provider of services in which of these project types? And so just select the one that best represents the organization or the project that you are affiliated with for the purposes of this training. And there might be different projects in your agency, and you might, be, sort of cross-train the different ones. But we're interested in primarily that project type that is the focus for your work. You can choose multiple answers, and it's populating as people fill out. So we'll just give it a couple of minutes, but it looks like we have a pretty great distribution across all of these component types. So right now, a lot of folks primarily focused on prevention, but we also have representation from street outreach, day services or regional access points, diversion or rapid resolution, shelter, and then transitional housing. It looks like there's also some folks from rapid rehousing and permanent supportive housing. So it's a great distribution across all of these. I'll just give it another minute or so. So if you're just weighing in, hoping to get as many people as possible, identifying which project type you primarily work with. And as I said, it really is great that we have such a broad distribution of folks that represent service delivery in all of these different areas. We're going to try and make the information that we provide applicable or useful regardless of the program type or the component that you operate. But in some instances, there are going to be specific nuances. So if we need to make those distinctions, we certainly will. It looks like we're sort of closing in on the end of the poll, so I'm going to go ahead and end it. So just so we have kind of a document or a documentation of where all the people are engaged in terms of their program types. So that's a great reflection of diversity and different perspectives coming at this. So on our next slide, I'm just going to advance these after we finish the poll. Let's see.
And Matt, just a shout out to Jenny, and she is a case manager for TANF.
Great.
Yeah.
All right. So now there's a graphic. I hope you all see this. It's a sort of a graphic representation of how the components work together to create the entire Rhode Island homeless response system. So sort of reading this left to right, the blue on the left-hand side is our coordinated access and our regional access points. And these represent the ways in which people, in the very beginning of their crisis or first reaching out for help, have different touch points. They could go to a regional access point. They could be contacted by a street outreach team. They might go directly to shelter, but coordinated access represents the front door to our system. And in this front door, there are some important components that occur. Triage, trying to understand what's the acuity or the level of crisis. And if you're in immediate danger, you're fleeing family violence or there's some other threat of violence, we might want to direct you to some other system that can more readily deal with kind of the immediate safety issues. So that triage is really kind of determining, is this the right place for you right now? Would you be better served maybe in a hospital setting or by a crisis service provider or victim service provider? And after that triage and determining that homelessness is the primary issue, and in fact, you're in the midst of a crisis and you need some kind of crisis stabilization services, then it progresses to a coordinate entry intake, and you're beginning to identify resources in the community that might benefit you to help you stabilize. The first of which, for many people, might be prevention or diversion. If the crisis is early enough in the sort of the stages of the crisis, and with maybe a moderate amount of financial assistance or maybe some legal aid or other kind of problem-solving assistance, we might be able to avert literal homelessness and reconnect you or re-engage you with support systems in your community. So you can see if you don't need shelter tonight, you're not literally homeless tonight, at the top of that, there's an arrow pointing to targeted prevention and then diversion. These are the lightest touch interventions, and the goal is to resolve the crisis as quickly as possible, as safely as possible. But oftentimes we're not able to resolve the immediate crisis. The person is literally homeless, or either outside sleeping in their car, or they do not have a safe place to stay tonight. So then we're going to look at providing a temporary shelter or some intermediate term crisis response that includes a residential component. Unfortunately, shelter is not readily available for everyone that would certainly benefit from shelter. So that's why it's so important to do that initial triage and then do targeted prevention and diversion to peel off as many people as possible who are able to resolve, able to either retain their existing housing or move or relocate to safe, appropriate housing and bypass shelter altogether. For those folks who are in shelter, then the next step is to stabilize them and immediately start identifying a rehousing plan. For many people, that rehousing plan could be exiting shelter on their own with no further assistance. And so then for those people, you're going to see they're advancing all the way to the right-hand side of the graphic in that purple block. And it could be temporary but safe housing arrangements, maybe moving in with family or friends or shared housing, relocating back to a community where they're originally from, where they have more supports. It could be community-based services. That could be community-based housing. So maybe it's some kind of group home or assisted home that's going to help support them in their long-term housing stability. But for many people, they're not able to resolve independently and they need some intermediate term housing supports. And that might be a rapid rehousing intervention. Rapid rehousing is a time-limited intervention that includes both a subsidy, so paying for utilities and rent for some amount of time, and services to help people stabilize and reintegrate back into the community. It's not a permanent program, but the intention is to very quickly move someone into a home-like setting using housing through private landlords through the private housing market. And then at the end of their rapid rehousing enrollment, hopefully they'll retain that housing so they keep that housing, either transferring the lease or keeping the lease in their name or transferring to some other appropriate housing. For some folks, they need some kind of program-specific interim housing, and this is typically transitional housing, either for a specific subpopulation like domestic violence, youth, or veterans, or for a specialized service, maybe treatment for a mental illness or for a substance use disorder. And that treatment is intended to be a intensive, short-term or intermediate-term intervention, and then people exit out of transitional housing back to permanent housing on their own. You can see at the bottom of the slide, there's an arrow for our highest need or most acute households. And these are typically people who've had multiple episodes of homelessness. They typically don't have income or certainly don't have enough income to support their housing. And there's other issues that are going on that either a disability or other kinds of housing complications. And taken collectively, all of these issues create great barriers for people. So they're going to need support for a long-term duration in permanent supportive housing. So they have a year or more of homelessness plus a disabling condition, and permanent supportive housing provides that long-term subsidy and services attached to the housing to help people maintain their housing stability. So this is the intention of the homelessness response system. In a perfect world, all of these projects would be working collectively in concert. There would be warm handoffs. There would be effective standardized assessment at each of these components. All of the information would be entered into a central database and would be used that information for care coordination, but also just to track how the system is doing. This is a kind of an aspirational graphic. It's intended to show what the system is intended to look like or how it's intended to operate. But the reality is it doesn't always function this way. And we'll spend more time talking about where things break down and what your role might be in helping to support both the sort of aspirational view of this optimal system. But before we do, I want to talk a little bit more about the complexity of the homeless definition. And this is where I'm going to ask Liz to jump in and kind of both give us some examples of why this comes up, and then just to kind of help us understand the different components of the definition.
That's great. Thanks, Matt. So Matt already mentioned this. So whatever you think of your own definition of homelessness, that's fine. You can have that. But what's just really important to remember is that HUD, and you'll learn throughout the whole presentation, they have their own way of doing things and their own definitions. So it is important that when we're talking about, and we're in HUD speak, right? We're doing HUD definitions, that when we talk about people experiencing homelessness, that we're looking at these four categories. And Matt mentioned something really important too, that these are eligibility requirements. So when we're serving folks, we need to know we need to make sure that we are serving eligible people, because the last thing that we want to do is ever have HUD come in and say, that wasn't an eligible person. So it's really, that's where this becomes very, very important. So I'm going to walk us through the four categories. They're really only three, but we put category three in just to, not mess up the numbers and tell you that kind of exists. So category one is literally homeless. So think places not meant for human habitation. Someone living in a tent, someone in a car, someone in a garage. It's also people living in emergency shelter, transitional housing, a hotel or motel that's being paid for by a charity or a government agency. Folks who are exiting an institution, for example, jail or hospital, and they've been there less than 90 days, and they qualified as literally homeless before they went in, they are also eligible. And many of you probably have dealt with this. We're counting days and really have to hold to that 90 days, which I know can be tricky sometimes. And as the slide notes, folks who fit this category one, literally homeless definition, they are eligible for permanent supportive housing, rapid rehousing, transitional housing, and joint transitional rapid rehousing. What's important, and we'll talk a little bit more about this later, for permanent supportive housing is that folks need to have a disabling condition. And we'll actually talk about that later, but that's very important for the eligibility of permanent supportive housing. So folks who are in category two are imminent risk of homelessness, which means that they will lose their housing within 14 days of the date that they're applying for housing assistance. They also need to lack resources and support service networks to obtain housing. They are eligible for transitional housing, joint TH, RRH, and rapid rehousing. I made a joke about category three. It's a little vague. So, category three is homeless under other federal statutes. So, it means it's not a HUD definition of homelessness. Basically, and stay with me here because it doesn't exist, if you had served everyone else who fell into category one, two, and four, and you said, where are other people experiencing homelessness? You might be able to get permission to do this. We've never seen it. We put it in here just so that you get the definitions. So again, our focus is going to be on one, two, and four. So category four, these folks are experiencing trauma from lack of safety related to fleeing or attempting to flee domestic violence. So these folks, it's very broad. It can serve folks who are experiencing dating violence, sexual assault, stalking, and other dangerous or life-threatening conditions. Also, that might relate to violence such as human trafficking. They have no place to go, and they lack resources to get a place to go. What's important here is the safety factor. So folks we're serving here, we want to make sure we are getting them to a safe place, and they are eligible for transitional housing, rapid rehousing, PSH, joint TH, RRH, and of course, domestic violence bonus projects. I'll pause there for a minute. Does anyone want to ask questions about definitions? Okay.
I don't
Oh.
see any questions in the chat, but someone did ask for the slides and just wanted to make sure, yes, we'll absolutely be sharing those slides afterwards.
Right. This is not an exercise in memorizing. And I should say that too. Some of the slides, especially like this, are just really helpful to use as a reference. You're not supposed to memorize this, right? So this is a good guidance if you need to look back.
Yeah.
Great. All right, we're going to talk about core components. I was so excited to see, I think like over 40% of you are prevention and diversion, right?
Mm.
Unsung heroes doing tremendous work. You're all unsung heroes, and everyone's doing such great work. But like Matt said, this is our latest touch, but so important because you are trying to keep people from entering our system. And we know that people who, if we look at children, that individuals who experience childhood homelessness are 50 times more likely to experience as adults. So we want to get them at the front door and do all the creative things that you guys do to keep them going into shelter, into any of our wonderful systems with wonderful care, but doing what we can to prevent homelessness right at the beginning of the crisis. So Matt mentioned some of the things that are done. You want to identify, and you are identifying immediate housing arrangements. Is there mediation with mom to get back home? Is there a landlord someone knows who can help out? What can we do? Can you sleep on someone's couch? What can we do to make sure that you're not going back to the streets or that we're not putting you into a system that we wish we didn't have to put you in? We also know that we're going to connect you to all kinds of financial services. We're going to connect you to agencies who might say, I can fix your car and you can get to work. Will that work? An agency that might say, okay, we can pay your rent arrears and keep you there. And again, doing whatever you can do, and you guys are doing it so well to just keep people not going into our system and keeping folks off the street, whatever creative solution that looks like.
Hey Liz, I have a question that's come up.
Of course.
I'm going to put you on the spot if you can't answer
Please.
this.
Please.
It's related to somewhat to the homeless definition and to prevention. So, for
Yes.
example, if someone is paying like a weekly a hotel by the week or an Airbnb by the week, and they have run out of funding and they will not be able to stay in that motel or that hotel, and they've already been paying like weekly, and they're now looking at potentially being on the streets at the end of this week, say their
Yep.
income has run out. How would we think about categorizing them? That certainly would be a prevention or a diversion candidate, but how would we think about their homeless definition
Absolutely
category?
too. Good, good, Matt. So as long as it's within 14 days, they have no place to go, they are going to fall into a category two situation.
Fantastic.
Yeah.
Thanks, Liz.
No, thank you. All right. I
Okay.
think we're going to talk about emergency shelter next.
Yes.
Great. So, most of you know are familiar with with emergency shelters, and these are really meant to be short-term places. I know I can speak for Connecticut. There's a lot of frustration that people are there 60, 90, 120 days, and that's not a short-term solution. But, and I know you have this issue in Rhode Island too, there is not another housing solution for folks. So, like Matt said, we're giving you definitions. It is supposed to be a short-term place for folks to stay, but sometimes it turns into a longer term stay. But the goal is to have it be a short term place and for folks to be able to take a breath, for their basic needs to be met. So we want to make sure they have access, the shelter's providing access to shelter, but access to food, people taking showers, and people feeling like they are safe. Because as we know, people aren't feeling safe and they're coming from really unsafe places. So shelter is critically important in providing that stability for folks to look what comes next and to help them with what comes next. And to work with them on housing focused case management. So, this is a client centered approach that puts the goals into the client's hands and says, you're expert, and I am going to guide you in this journey to find housing, but really honors that the client knows best what they want and to really help them figure out how they can get housing and how that journey can be successful into eventually being stably housed. Really using strength based, and I know you guys from knowing a lot of your practice that you're using strength based practices, really relying on, again, the expertise of the client themselves, working towards housing goals. And working towards that, as you know, means so much work in terms of getting an ID for someone, making sure that they have paperwork in process, making sure they have both cash and non-cash benefits, working with DSS. It's a lot of work. It's a lot of work. And the emergency shelters are funded primarily through HUD ESG and then through some private resources.
Liz,
Okay. Yeah.
someone did raise their hand. I think it's
Oh, I'm sorry.
Samuel.
Okay.
I know.
I
I
didn't
just
see.
noticed
I
it.
didn't see.
So yeah.
Did,
If you have a quick question, please jump in.
of
Samuel?
course.
I did have a question, but Miss Liz answered it.
Oh,
Oh,
Thankfully.
look at that.
perfect.
Look at that, Samuel. Well, you jump in. You jump in if you have something to add here.
I believe we had a second hand from Michaela Serrano.
Perfect.
Thank you, Sarah. I'm sorry, I couldn't focus after we got past that last slide because I was trying to figure out for the example that was used. You stated that if a family was living in a hotel and they were no longer able to pay, or an Airbnb and they were no longer able to pay, that the diversion would be used and they would fall under category 4, which is fleeing domestic violence, I believe.
We category two, actually.
Okay, so imminent risk of homelessness.
You
I just
got
wanted
it.
to confirm. I was like, wait, did I hear that wrong? Okay, thank
You
you.
know what? I also could have said it wrong. So thanks for clarifying category two. Exactly.
Appreciate that. Thank you.
No, thanks for listening. Thanks. All right, excellent. So we talked about emergency shelter. We know that there are other project types. So these are CoC project types. So these are HUD funded CoC projects. And we're going to talk more about all the different projects and how they're funded, but we just wanted to go through some definitions. So when we talk about supportive services projects, this is outreach, it's your housing navigators, drop-in center, other services that fall into just supportive services, not connected to housing. Our transitional housing is temporary housing that serves as a bridge between homelessness and permanent housing. It's limited to 24 months. I will tell you in Connecticut, we really encourage it to be more like 12 months, but it's very difficult. Again, we just talked about this. The housing market being what it is, it's really tricky to get folks out of transitional housing, but it really is meant to be a shorter term solution. We have
Miss Liz,
oh, yes.
I'm not trying to jump off topic and change
No,
anything, but
please.
how because you said it's what is it, 12 weeks you said, or 12 months you're
Oh,
saying?
24
How do we
months.
24 months, how do we change that then? So if the factor is that we have to try to get them housing for 24 months, how do we try to build long term? Because I come from the shelter aspect of things. So when you were just speaking about shelter, that's why I raised my hand, because it was very important to me. How do we get the people to give them housing and give them a chance to experience that life of self-ability, I reckon.
Sure. Are you asking, Samuel, how we get folks out of transitional housing or how we get folks
No,
into?
how we get them, how yes, ma'am, how we get them into like long-term housing, in the sense of like they have this apartment, they're not worried about being put out from day to day or from month to month.
Oh, Samuel, that's the $1 million question. So perfect, right? No, great. I mean, great question, right? This is what drives your work, and and
Yes,
other
ma'am.
folks can jump in on best practices here. I think having a fantastic group of landlords that you work closely with, and I know that that happens a lot in your state, so that you can educate landlords and make really good connections with them, and then just networking everywhere you can for what exists. Where are the lists of resources, ensuring that folks are on every Section 8 or public housing wait list and casting the widest net you can. But it's really hard. It's really hard in this housing market. And then ensuring, and we'll talk a little bit about this later, that we're connecting our folks to every mainstream resource we possibly can to make sure that they have cash and non-cash benefits, and if they can work, that we really help them get a job, because we know that no one has enough money and that you have to have money to have housing. Those are some of the answers I know. If anybody else wants to jump in, but it's a lot. It's the big question, Samuel.
Yeah.
Sarah, did you want to jump in?
We do have a question and comment in the chat from Derek about category 2.
Okay.
So I think there are a lot of people served who have very unstable living situations, but there's not a definitive end date on them. So the question is, can they be category 2? If it's an open question of if they can pay for like their Airbnb from week to week, do they count as category 2?
They just need to, I mean, the definition is that within 14 days. So if they come and say, that's it, I'm done. My family and I, or I, whether you're alone or with someone, have no place to go at that point, and that's documented, that's what the situation is. And we can provide more examples and more detail if folks want that. Matt will make a note and we'll, at our next
Yep.
presentation, we can give more examples and sort of the pitfalls and documentation needed. Because I don't think as I'm watching iClock, we're not going to have time to do that today, but we
Mhm.
will definitely address that. And I hear that folks want more information there. Great.
Great.
So I'll move quickly. So then we have rapid rehousing, and this gets folks very quickly into housing, getting them rental assistance and getting services, not as intense at all as permanent supportive housing, which we're going to talk about in a minute.
Oh, with no sweetener.
I missed that. And that is limited to 24 months. There is a projects called Joint Transitional Housing and Rapid Rehousing. And this is the combination of two models in a single project. And the total stay there is 24 months, where folks move from a transitional housing model into a rapid rehousing model. Permanent supportive housing is our most intensive, costly project that we have. So this is with folks who have a disabling condition. And HUD says that a disabling condition is one that's a physical, mental, or emotional impairment, which includes substance abuse, PTSD, or a brain injury that's expected to be long continuing, substantially impedes independent living, and could be improved with housing. So there is a specific definition, though it's broad. And we know that a lot of folks fit into permanent supportive housing, but we also know that it's a very, very expensive intervention and that we need to save the permanent supportive housing for our folks who need it the most. It's not time limited, so folks can be there forever. But in a lot of cases, folks may be able to move on. And so we always want folks in PSH to be thinking about, is this where I belong forever? And they can stay there forever. But could I move on again? Can I be on a Section 8 wait list? Do I have a job? And now I may be able to go out on the market and have my own apartment. So that's one of the project types. Another is the Homeless Management Information System. And this is the database used by providers to collect client level data on characteristics and the service needs of folks that we're serving. It is mandated by HUD that we have this system. And then CoC planning is a project, and these great folks support all the work going on at the CoC, all the different CoC operations. Okay. So you also have youth housing demonstration projects and DV projects as part of your CoC. For youth demonstration projects, I know that you guys have outreach and navigation, some rapid rehousing, and these projects are targeted to the unique needs of young people. If any of you have spent time around folks between 18 and 24, they have unique needs. And so the projects are tailored to address the service and housing needs for these young people. And then domestic violence projects, they're rapid rehousing and coordinated entry. And here I talked a little bit about it before. The focus is on safety, of course, housing and doing all the other pieces involved in rapid rehousing and coordinated entry, but really a safety focus. So additional services might include legal services to ensure if there are protective orders, different things to ensure that survivors are protected from abusers. Great. Okay. So this is the money. Show me the money. What are we doing? So what are we doing with our $37 million? Lots of great stuff. Lots of good funding. So this is funding from the CoC. And I'm sorry, I'm putting my, I see Kimberly's hand up. Kimberly, do you have a question before I talk about the money?
Yes, I do. I'm sorry.
There's no apologies.
So how long, I wanted to know, what would someone have to do that is in a domestic situation to get into a rapid rehousing program?
Sure, good question. So Matt gave that beautiful slide on sort of the system. So they would enter they can enter two ways, through the coordinated entry system, or they can enter through a domestic violence number, which I don't think we're showing that here, but we can provide information on that. So there should be two ways they can come in through the system, because there is coordinated entry for survivors as well. So we always want to make sure that survivors have the option of either entering through the DV system or entering through the main coordinated access system.
Okay. Thank you.
Of course.
So, Miss Liz,
Yeah.
is the coordinated entry system still up in Rhode Island? From my understanding that the coordinated entry system ended in Rhode Island. I reckon that you're saying it's a different system for domestic violence.
I can jump in on that. This
Please,
is
yeah,
Sarah
let
St.
Sarah jump in.
Laurent. Sorry, Liz, I don't mean to step
Oh,
all
I
over
know.
you.
I love you jumping in.
Perfect. So hi everyone, I'm Sarah St. Laurent. I'm the coordinator for the CoC. I sit at Rhode Island Housing, which is the collaborative applicant for the CoC here in Rhode Island. So coordinated entry does still exist. The call center that the Coalition to End Homelessness ran, that is what closed down. But those services that they've offered are now available through the regional access points. And so people who are looking to get access to our system can go to a regional access point and get assessed. So taking the housing assessment is how you get on the housing queue for rapid rehousing and permanent supportive housing. Sojourner House is a regional access point for people who are experiencing domestic violence and fleeing. Street Outreach also does housing assessments, so there are lots of ways that people can connect. So I'm really glad we had the opportunity to say coordinated entry is still a thing. It's just that the call center has closed.
That's great. Thanks, Sarah. That's really important. Great questions. I'm so glad we have Sarah here to answer those too. So we're looking at the money. So this is the money that your CoC brings in and that the Consolidated Homeless Fund brings in. And the Consolidated Homeless Fund lives under the Rhode Island Executive Office of Housing, so your housing office, and the EOH manages ESG funds. We talked a little bit about that. So they fund emergency shelter, street outreach. Sarah just talked about the regional access points, warming centers. So it's the money that those folks and that the HUD CoC funds come together to make over 37 million. And I won't read each of these, and I know we have to keep moving, but just that if you look at the pie chart, you can see that about a third of the funding is spent in emergency shelter. And then about 40% is spent if you combine permanent supportive housing and rapid rehousing. And then you're funding a bunch of other HUD required services, such as HMIS. And you have the housing problem solving folks that Crossroads runs below, and you can check out the other numbers. Okay. So we keep saying CoC, and Matt and I were laughing the other day about this because, there's a continuum, there's care, it can mean a lot of things. So again, we're going to be in HUD speak. So in HUD speak, a continuum of care is a group of folks who come together from the public sector, the private sector, coming together to end homelessness, to prevent and to end homelessness. It is a requirement. So you guys got just over 17 million from HUD this last year. You cannot get $17 million annually from HUD unless you have a continuum of care. It is not optional. So it is mandatory, but it is really a good idea too, right? So really great people to come together trying to prevent and end homelessness, sharing lots of resources, lots of ideas, and trying to not duplicate services and trying to address whatever gaps there are in the systems, identifying the needs in the system, and really coordinating. Again, we keep talking about precious resources. These are precious resources, and we all know we don't have enough of them, so we need to really be smart about how we use them. We also need to meet with and connect with, we'll talk later about our partners, mainstream resources. So as we know, the homeless housing and services system doesn't have enough money or resources. So we need to reach out to our friends at Department of Labor. We have to reach out to our friends at DSS, and we have to use every resource that exists. We call those mainstream resources, and make sure that folks experiencing homelessness are able to access those critical services. Are there questions? See stuff popping up. No? Okay. So what else does the CoC have to do? I just talked a little bit about identifying gaps. Where do we just not have a service? Who are we not serving? We really need to look at that. We want to use all the information that we have to come together, assess what's going on, and improve our system and our services so that the folks we're serving get the highest quality services, and that their rights are protected, and that we're doing everything that we should be doing for folks experiencing homelessness. We want to establish policies. So again, we want to make sure that people's rights are protected, that people are getting fair and equitable access to what's out there in the system. We want to make sure that there are policies around governing the projects and decision making. Again, making sure that we're doing everything right, that we're all looking at this together so that we can provide the best services and housing to folks. And I've already talked about it being fair. We always want there to be equity. We always want there to be transparency so that each and every person that we're trying to serve is treated properly. Okay. So we're not done. There's more to do. So we need projects to make sure, Matt talked a little bit about this too, all the different requirements, right? And we talk a lot in our world about compliance. Are we complying with all of the requirements? And I know I'm going to say it twice now, so I don't want to scare people. But part of compliance is so important because we never want anyone to lose their money. HUD has a lot of rules, and some of them make a lot of sense, and some of them you got to look up and you really have to pay attention to get right. And we always want to make sure, first and foremost, that folks are being served properly. But then somewhere down the line, we can't serve them properly if we lose our money because we aren't in compliance. So one of the key roles of the CoC is to ensure that providers and everyone in our system really understand what's going on because it's not easy. There's a lot out there to understand. And so the CoC helps makes that digestible for all of our folks. We were going to talk about this in more detail on another slide, but the CoC has to submit the application for the annual competition. You will hear us call it the NOFO a lot, the Notice of Funding Opportunity, or the annual application. That's lots and lots of work. We have a whole slide on it. Also, the CoC needs to make sure that coordinated entry exists, and Sarah just gave us some good information on that, that there is a homeless management information system to ensure that we have data on all the folks that we're serving so that we can serve them efficiently, effectively, and share that critical information. And then there's reporting required. We're going to talk a little bit about this later. The point in time counts, system performance measures, longitudinal system analysis, and annual performance reports. Again, reporting requirements. So that sounds like a lot. And the CoC does do a lot. But to make all of these tasks happen and to make the CoC run, the CoC will assign these responsibilities to different agencies, and Matt's going to talk a little bit about this later. So while the CoC is responsible for making this happen, again, it's other agencies that are actually carrying out the tasks to accomplish them. Okay. So I promised a slide on the CoC competition. I could talk all day about this, but I'll talk quickly and just give you highlights. So the CoC competition, or you're going to again hear us say the NOFO, HUD makes about just over $4 billion a year available to CoCs all across the country. And Rhode Island CoC is going to compete with CT Boss. You're going to compete with the Nebraska CoC. And it is a competitive process. It's also really important to remember that renewals, so projects happening now that want their money for next year, they're not automatic. And that funding isn't guaranteed. So both at a local level, there's a review process. And then at a HUD level, there's a review process to say, hey, are these projects doing what they should be doing, serving who they should be serving, and in compliance with the rules? I've mentioned this a few times. You guys got over $17 million in CoC program funds. The Rhode Island CoC asks for folks to submit applications for new projects every year. Typically, this is in the spring. And these projects are reviewed and ranked and evaluated by a funding committee. And this is generally standard practice. This is what CoCs do because there's lots of great ideas, lots of great projects. But they really do need to be reviewed to see, can this happen? Is it feasible? And is HUD going to fund it? Because ultimately it goes to HUD, and you only want to submit new projects that we think HUD will fund. We can tell you that this year, the NOFO, or the competition, is supposed to start June 1st, according to HUD. And agencies are going to apply, as I mentioned, we're going to have renewal projects, we're going to have new projects, and that is going to happen according to HUD starting June 1st. We also, HUD has mentioned that everyone will know decisions by December 1st. So, and as Matt said, we're putting the facts out here, but anything can happen. But that's our understanding currently. Anything on the HUD competition? Questions, comments? Great. I think I'm handing it over to Matt to talk about some governance.
All right. So obviously, all of these functions and these responsibilities that Liz has now outlined, you can't provide governance or decision-making or authority for these in a diffused way. So HUD requires that each continuum of care or CFC identify a group of people to make decisions to act on behalf of the membership of the continuum of care. And this is what the Rhode Island CFC board is. So it has a kind of a governance and overseeing function. And it doesn't actually operate the HMIS or coordinated entry, or it doesn't submit the NOFO application, but it designates an entity to lead those processes. So it is a responsibility of the CFC, for example, to have an HMIS. But the CFC and the CFC board doesn't actually operate the HMIS. The CFC has authority to identify an HMIS lead, and that HMIS lead is then accountable to the CFC board. So, for example, in Rhode Island, it's Rhode Island Coalition to End Homelessness is the HMIS lead. That's just an example. But the board also ensures compliance with these HUD requirements, which might involve review and some monitoring and some evaluation work. Finally, when the NOFO or the CFC application is submitted to HUD for consideration, the CFC has to approve that list, all of the projects that are included in that application, the amount of funding that each gets, how that application is put together. That ultimately is submitted to HUD for a final decision, but the CFC board is the entity or the group that finally approves it and submits it. The Rhode Island Coalition, the Rhode Island CFC is the collaborative applicant. That is Rhode Island Housing. They prepare the application to HUD on behalf of the CFC. So look at the NOFO when it comes out. We'll list a set of funding priorities and some guidelines or expectations for how the application is compiled. And Rhode Island Housing reads through those guidelines, those instructions, and prepares the consolidated application on behalf of the entire state for the CFC. Rhode Island Coalition, the Rhode Island Housing also drafts policies for how systems are going to operate, individual projects will operate, but ultimately the CFC board then approves them. So Rhode Island Housing is doing the work. They're the sort of, the workhorse of compiling and organizing and analyzing and ensuring that the day-to-day operations of the CFC are up and running and operational. That's a lot of work for Rhode Island Housing. They're also doing some evaluation work, and they're helping with monitoring to ensure that any HUD grant or federal funding that comes into the community is operated in a way that's consistent with or aligned with those funding expectations or requirements and grant contract obligations. And then the Rhode Island CFC website, which is sort of a kind of a information warehouse for lots of resources and where compiles all of these policy documents and instructions and guidelines. All of that can be found on the new Rhode Island Continuum of Care website. Liz mentioned earlier the Emergency Solutions Grant, or ESG. So the CFC program is a competitive application. Again, that application is submitted to HUD. HUD makes those decisions around funding. But the ESG program is a entitlement program. So this is a formula grant. The formula is based on a number of different factors related to the population and poverty rates and your housing stock. And each jurisdiction, in this case, the state of Rhode Island, is guaranteed a certain amount of funding. And then the Executive Office of Housing for the state of Rhode Island then is making determinations about how those federal resources are then distributed across the state to eligible activities. So they can fund outreach, shelter, prevention activities. They also fund rapid rehousing and then HMIS. And so each one of those different program types might receive ESG or Emergency Solutions Grant funding. In Rhode Island, the Executive Office of Housing receives the ESG funds from the federal government and then passes through those funds or allocates those funds out to individual projects throughout the state. They ESG recipients, so if you're a shelter, you operate a shelter and you receive ESG funds from the state, you're obligated to coordinate that service provision or the shelter operations with the continuum of care. So even though it's a different funding mechanism and it's administered by the state, there is a requirement that ESG funding recipients and CoC funding recipients work together to coordinate, align, and make sure that the way they're operating their projects are in accordance with one another. HMIS, the Homeless Management Information System. This is another core system component of your homelessness response system. Essentially, all persons who experience a housing crisis, whether it's prevention, emergency shelter, they're getting rehousing assistance, or they're maybe just getting services or case management or navigation support, basic information about each participant at a household, at an individual and household level is collected and then entered into this statewide database. In Rhode Island, it's Clarity, and there are very specific requirements around the types of questions that we ask and the response categories for those questions. And all of that information, in addition to service transactions, so that they got a night of shelter, or they got a case management unit, or they got financial assistance. So both the people that are served and the things that we're doing, the services that we're providing, all are entered into this system. There's one big caveat, though, for purposes of safety and security of persons fleeing or in domestic violence situations. That information, because it is identifiable at a person and a household level, it must not be entered into HMIS. Victim service providers are obligated to collect all of that information about both the individuals and households that they serve and the services that they provide, but that information is managed in a comparable database, not in HMIS. So if you're a victim service provider or you're operating a domestic violence project, you still have to collect all of that information about who you're serving and what you're providing. It just isn't in the state's HMIS. So all of this data is compiled to help us with care coordination. It helps us understand how many people are coming into the system on a regular basis, how they're using the system, what services they use. There's lots of really useful information about the broad system, and some standard reports from each continuum of care across the country help us to understand not just what's happening in Rhode Island, but how Rhode Island sort of compares on a similar sort of a scale or a set of expectations around data across the country. So these are system performance measures, and we'll talk more about those, or SPMs. System performance measures are indicators of the effectiveness or the impact of our entire crisis response system. So are fewer people becoming homeless? Are they staying shorter periods of time? Are more people leaving homelessness and getting permanent housing? Are fewer people returning to homeless after they've exited? Those are all the kinds of system performance measures, or SPMs, that HUD collects, or we collect, and then we provide them to HUD. And HUD uses those SPMs, or those particular measures, to gauge how impactful the state is. And then that contributes to scores and to funding decisions. So it's always really critical to continually work towards improving our performance, because it directly relates to how much resource comes into the community. Another HMIS report, the Longitudinal System Analysis, or sometimes referred to as the LSA, describes over an expanse of time, so over a full 12-month period, how the system is operating. So not just a sort of a point in time picture, but sort of experientially over an entire year. And that gives us a lot of useful information about um, who's homeless, what are the factors that are contributing to their housing instability, and what kinds of interventions or services are most likely to help them resolve and maintain housing stability for the long term. I'm sure many of you are familiar with the point in time count, or sometimes referred to as the PIT count. This is similar information that's collected, but it's just one particular day. It's a snapshot of how many people are homeless. It's typically the last week in January, and every single community around the country collects a point in time count or a PIT count. It includes all the people who are in shelter, people who are outside, who are not in shelter, so they're not engaged in services, and who are in HUD-funded housing interventions. And it gives us it's flawed because it's only one particular point in time, and it may not express the full extent and scope of homelessness in Rhode Island at different times of the year. But because we do that point in time count every single year, that last week in January, over time, we have multiple point pit counts that enable us to kind of do trend analysis. So if our point in time counts or pit counts are going up or going down, it's an indication of how effective our system is. And then the housing inventory chart, or HIC, is an accounting of all the beds, the units, the service slots by component type. So how many shelter beds are in Rhode Island? How many are designated for families versus singles or youth? What's the number of rapid rehousing slots that are available? That HIC information, when compared to our point in time count, helps us understand how many people need assistance, and then the HIC is telling us what resources we have to serve them. So those are really useful gauges of how effective our system is and how expansive and responsive the system can be. And then finally, the annual performance reports. These are particular to individual projects. So any project that's getting continuum of care funding on a renewal basis has to prepare and submit an APR or a performance report to HUD, and it describes how many people that project has served and the demographics or attributes that are associated with the population that they're serving, and then the outcome of the services and supports that they're getting. For Rhode Island, the Rhode Island Coalition to End Homelessness is the lead for HMIS, and so is really kind of shepherding us through all of these critical reports and these data collection functions. That's a lot, but I'm just going to keep going in the interest of time. The HMIS lead, as I said, is the coalition, the HIC, the housing inventory count, the PIT, the point in time count, the LSA, or the longitudinal system analysis, and the SPM, or system performance measures, are all those standard reports of analytical functions that the coalition is performing on behalf of the state. So we're going to take a quick check-in now to see how this information is landing. So I'm going to stop. Oh, we've activated the first poll. Great. Are CFC grants always renewed? Remember, we were talking about that renewal process. I think Liz shared that information. It was on a slide. So if you kind of think back to when we were talking about the CFC grants, the NOFO grant, are the CFC grants always renewed? Is that sort of continuous funding or almost guaranteed funding from year to year? People are starting to weigh in, and it's actually different perspectives on whether or not they're always renewed versus not a guarantee. And if you've answered that question, you might want to go ahead and filter down to the next question. Who makes the final decision on which projects get funded? We talked a lot about different entities that are involved in the process. The Rhode Island Housing does some monitoring and evaluation and technical assistance support. The Executive Office of Housing, we talked about, manages the Emergency Solutions Grant, and they also have the coordinated or consolidated homeless fund that distributes state funding. And then the continuum of care, the body that oversees the process, and then HUD. So what's your memory on which entity actually is making the final decision? And then the third question, who establishes policy for the Rhode Island continuum of care? Policy that involves who we can serve, requirements, how these projects are going to operate. The governing entity that establishes, that takes the federal requirements and then operationalizes them in terms of policy. Who's the entity that's doing that? So, lots of questions for you to weigh in on. I know there's a couple of things to consider in each of these, so I'll just give you another couple of minutes because we're approaching the end of our scheduled time. So, if you're sort of, hesitating, go ahead and just land on a question or land on a response, and then we'll end the poll and look at where things are. A couple more people are weighing in. So I'm just gonna give it another second, quickly decide. Okay, now let's look at where we ended up. So I think I'm sharing the results. I hope people can see that. So the first question, are CFC grants always renewed? The answer is no, they're not always renewed. Some CFC grants either because of poor performance, the CFC elects not to include them in the application. Maybe the project's obsolete. It was designed years and years ago, and there are other more effective responses. Or maybe the population that it was serving can be served more readily or more effectively with different interventions. So it's not a guarantee. CFC grants are not always renewed. The answer to that is no. Then the second question, who makes the final decision on which projects get funded? The answer is actually HUD. We have a lot of opportunity to sway and direct and shape, but the ultimate decision about whether or not these CFC grants are funded comes down to a HUD review and a HUD awarding of funds. So they are the entity that makes the final decision. And then finally, who establishes policy for the Rhode Island continuum of care? Certainly, Rhode Island Housing and the Executive Office of Housing have a lot to say, and we use HUD to establish grant requirements, but ultimately, it's the Rhode Island continuum of care. They are the body, the governing body, that with oversight over the whole system. So that's the answer for that third question. All right. I'm going to move on to the next slide. We just have a couple minutes, so I'm going to try and go as quickly as possible. I'm going to talk a little bit about coordinated entry. Coordinated entry has been around now for about 7 or 8 years. And if you haven't been part of the system for longer than that, you might not even remember what it was like before this. Before coordinated entry, individuals who were experiencing a housing crisis had no front door, no designated access points, no focused, intentional way to access crisis response services. The onus was on the individual to navigate complex requirements and to figure out where they should go that would best meet their needs. And as you can imagine, this is not a very human-centered or client-centered approach. All of the responsibility was on individuals who were in the midst of their own crisis, and they had to figure out, well, what am I eligible for? Where do I go? How do I get there? What's the next step in my rehousing pathway? So the idea of coordinated entry is that we would designate specific access points or front doors to the system. And these can be outreach workers, they can be a regional access center or a RAP, it can be a hotline, it can be a shelter. There's lots of different ways that you can define this, but the idea is that you centralize or designate these access points, and then they're all doing a uniform assessment. And that assessment identifies which housing intervention people would best be served by. Is it transitional housing? Is it rapid rehousing? Is it PSH? And then coordinated entry uses standard prioritization criteria to sort of queue people up or ensure that the highest need people are served in the order that's determined by the continuum of care. So it's overlaying on our crisis response system intention and direction and guidance and focus to a system that historically did not have those elements. HUD requires that all coordinated and all communities have these four essential coordinated entry elements. The access points, as I described, can be either one single point of entry or they can be distributed across multiple different types. So, as I said, it can be 2-on-1, it can be a shelter, it can be an outreach team, but you have to identify how to enter the system. And you have to market this. You have to clearly describe for persons in crisis what the instruction is or what the guidelines are to access crisis response services. The next phase of coordinated entry is a standardized assessment. Every assessment has to ask a set of questions that guide the worker, the frontline worker, the case manager, through an intentional decision process of gathering information around what's happening for a particular individual or a family, and then what kinds of resources they might be eligible for, and of all the things that they're eligible for, who's then going to be served next or who's the next priority. Assessments typically are phased or they're sort of built on you ask an initial set of triage questions, and then if you don't resolve the crisis, you move on to diversion. Diversion doesn't work, you might do a full intake. If a full intake doesn't work, you're going to do an eligibility assessment to determine what other resources you might direct someone to. And then a comprehensive assessment might bring in a whole housing history and behavioral health needs. So think of these as sort of layered on one another. You're building a more complete, a fuller picture of what's going on and how the system can respond. And then ultimately, the goal of the system is to make a referral to a housing resource, whether that's independent housing, some kind of shared housing, supportive housing, or some arrangement that's a safe, appropriate placement for that particular household. Liz is going to jump in and talk about some of the key partnerships in our continuum of care systems.
Yes, and I'm thinking about Samuel's question, where is everyone going to go? So it's really important, Samuel. I'm going to use that every training because that's so awesome, right? So we have great resources in our CoC, of course, here in Rhode Island, right? But we also need to make sure that we are working with the public housing agencies, with mainstream affordable housing, like I said, with every and any landlord who will listen to you to educate them about how great our clients are and the supports that we can provide and removing all kinds of barriers. So it's so important that these people are at the table. We want to make sure, that's okay, that hospitals, that healthcare systems are working together. We want to make sure that folks in the ER know who to call, that they have our outreach team's numbers and can do that critical connections with them. We know that so many of our folks are in great need of mental health and substance use treatment. So these folks are at the table so that we can help navigate their system. Of course, we want to know the unique needs of survivors, domestic violence survivors, and the service providers, better understand, and we're always working through this in Connecticut, how our systems can work better together to serve folks' needs. There are always things about child welfare, family serving systems to ensure that our families are well taken care of and that we understand what these folks need from us, but that these folks understand, again, the unique needs of the folks that we're serving. Legal and corrections is huge. We want to have them at the table to make sure that, again, we know each other's systems better and can serve our folks. The education systems, it's critical that people know what their rights are, that people know that school districts are educated on making sure that they know that our kids can be at their school of origin, ensuring that there's transportation for our folks. And I do keep talking about this employment, workforce, and income and benefit systems. Our folks cannot be housed unless they have money, unless they have non-cash benefits. They need to be able to work if they can work, and they need to be able to go to an American Job Center, and those folks need to work with our folks, and we need to really have a strong partnership to make sure that folks can have some income. Yep. You know what? I'm going to skip this, Matt, unless you disagree.
Yeah, no, we're
Okay.
running out of time. Yeah, so we'll
Running
keep
out of
going.
time. And I'm also going to go really quickly through HICPIC because Matt did a really nice description of this, but I will do the plea, which is to please, if this is part of your job, always attend the trainings because they are critical to ensuring that we're all on the same page when we are doing the point in time count, and that when you are reporting, please submit on time and give all the information needed. And if you want to know more about HICPIT, check out that website. So this chart tells us that there has been an increase by 35% from 23 to 25. And we can see that the biggest increases were in unsheltered homelessness and in emergency shelter. It shows that about 2/3 of the people, if we look at our population, are individuals, about 1/3 are families. And we see that the unsheltered homelessness almost doubled from 2023 to 2025. And emergency shelter is also up from 2023 to 2025. So you guys can look at the trends. Yeah. Oh, that's okay. Hey, go ahead. We got to keep it moving. I like it. That's just next slide. I'm not going to spend a lot of time on system performance measures. Matt touched on this, but this is really important information because it's collected from street outreach, shelter, transitional housing, rapid rehousing, PSH. And it has us look at 6 really important elements. I won't read through all of them, but it lets us know how are we doing as a system. Are we getting folks into housing? Are they coming back? How long are they staying with us? Again, with the employment, are we increasing their employment and their income? Are they new to the system? So these are really important. We look at them in the aggregate all together to see how we are doing in Rhode Island. Okay.
I'm just going to say briefly, I know people have to drop off because they've got other commitments. We've captured all of the questions in the chat and we will respond to those. And we're just going to, if people can hang with us for a couple more moments, we're going to finish this slide deck, but I've captured all the questions and we'll respond in subsequent trainings.
Perfect.
I think we addressed these. All right. So the poll question that we wanted to engage, and I know that we're unfortunately kind of pinched for time, but we just wanted to see how this information is informing the things that you might do that could contribute to positive outcomes for your clients. Can you work with clients to get them into the right housing service? You're going to collect full, complete, accurate data and enter that into HMIS. You're going to work on building some of those partnerships that Liz has described, because you can't do this alone. It is not feasible to manage this independently. We need kind of this like blended network of supports from other systems. So just trying to get at a sense of how might the information that Liz and I have shared this morning activate you in the kinds of activities that can contribute to a stronger system, more effective programs, and ultimately helping people who are in the midst of a crisis and their housing, their homelessness. Lots of responses across the system. I'm just going to move on so that we can end our focus for today. Some resources for folks who will be able to respond. If you have burning questions before our next training, reach out to one of the people here. We're going to share slides and information so that you have that. I apologize that we kind of ran up against the end of our time. I know that we got a bit of a late start. We have captured questions in the chat. We'll respond to those questions. We'll start with our next training by answering those questions and then jump right in. You are all such a great, engaged, thoughtful group, and it really invigorates Liz and myself to have great questions, and so appreciate it. And we're looking forward to spending more time with you on these future topics.
Thank you so much.
Thanks, everyone. I appreciate it.
Bye. Thank you.
Thank you. Thank you for having
Thank
us.
you.
All right. Good luck, everyone.
I can't
See
wait.
you next time.
I actually can't wait. I can't wait for the next class.
Oh,
Yes.
Samuel. Oh, you made my day. You made my day, Samuel.
Well, we say in Latin, saber es poder. Knowledge is power. So the more knowledge I have, the better I can do my job and help the community that I'm trying to serve.
Awesome. We're going to get t-shirts made just with that, Samuel.
Yes, ma'am.
Love it. Love it.
Thanks, Miss Liz. Thanks, Matt.
All right. Thanks,
Thank
everyone.
you. Take care.